So now we're going to give a brief breakdown of root canal therapy. So in this case, root canal therapy needs to be performed when there's trauma to a tooth, or of course, if the decay is so extensive that it reaches the nerve. So for the x-ray purposes here, this is number 7. So as I go along, I'll show you the different x-rays. So the first thing that we want to do is after the patient's numb, we're going to place a rubber dam to isolate the tooth. We want to keep it dry when we need to. And then, of course, as we irrigate and clean it, we don't want any of that, those materials going down the back of the patient's throat. So once the rubber dam's placed, then the decay is going to be removed. Then, once the nerve, we have access to the nerve, then we're going to start the procedure. So we actually start with, we have these little files, and these little files have threads to them. So that's actually what they're going to place inside the tooth first, down inside the canal space. You can see those threads. So what they're doing is when they're placing, and these files come in many different sizes and are also color-coded. So when they place these files, they're removing the remainder of the nerve, and at the same time, they're also widening that canal space. So they're using different size files, which of course increase that width to prepare it for when we're ready to final fill. So once a file's been placed, now we want to check the length of the root. We can do that by either using a apex locator, or we're going to actually leave the file in, and we're going to take an x-ray to check on the length. And you can even see those literal threads from the endofile. So after the doctor is happy with the length, what we're going to do is now we're going to start to irrigate. So depending on your doctor, they use different types of solution. Sodium hypochlorite is one of the more popular ones. Then, so they're going to irrigate, then they're going to use those files. Or now one of the advancements in dental technology is rotary files. So this actually just gets hooked up to a handpiece. So instead of hand filing all these canals, now rotary file gets placed into the handpiece. Same thing, they're color-coded, just like the regular files. So you're going to go through the steps. Those rotary files are doing exactly what I said earlier. They're removing the remainder of the nerve tissue, and also they're widening that canal space. So after going through those steps, irrigating, then we're going to use paper points. We're going to dry it. So your doctor's going to place these inside the canal space. And what they're doing is these paper points are soaking that up, but they're also checking to ensure that it's dry. So they might go through a few of these, especially if you're doing a molar with 3 or 4 canals. So once it is dry and we are happy with our predetermined length, then we're going to place gutta percha next. And a gutta percha is a soft, rubbery material that is placed inside of the canal. Now, some doctors might want to do a check film here as well, because they want to ensure that before they cement this gutta percha in, that it does, in fact, go to the length that they want. So here I have another film. This is where the gutta percha has been placed. Film looks good. So now we're going to go ahead and mix up our cement, and depending on your doctor, they'll either place it directly on a gutta percha, then place it back inside the tooth, or they might use the cement and they might put it on a file, or even a spiral, another type of rotary file to ensure that the cement gets down inside that canal space. Once the gutta percha is placed and cemented, of course, now we still have it sticking out the top of the tooth. So they're actually going to use an instrument and burn that off. So don't be alarmed by that. Once that is burned off, then usually they're going to place a temporary filling inside the tooth. Depending on your doctor, they might give it a week or two to ensure that the root canal therapy has in fact worked. Then they want to bring you back. Normally, standard treatment of care is they'll bring you back, put a permanent core inside the tooth. They'll either just place the core material or they might even use a post. So the metal post, this is going to get cut and placed inside one of those previously filled canals with the gutta percha. And what that does is it's kind of, if you think about rebarb, it's going to give us some strength and something to build off of to prepare your tooth for the crown. Because ultimately, once the root canal therapy's been performed, here we have our final fill. But once that root canal therapy's been performed, we want to put a crown on there to give this tooth some stability. Because once you do the root canal therapy, the tooth is essentially dead. It no longer has the vital nerve nutrients and blood supply flowing to it. So the tooth is more susceptible to breaking, can become more brittle. So that's why you want to put a crown on there to give that tooth some strength. So this is just a quick overview of root canal therapy. I will be doing some more videos a little bit more in depth, but if you have other questions, please feel free to ask or contact us. If you have something else that you'd like to see, then of course, thank you for your support. You can find us under Cornerstone Dental Assistant Academy or Dental Assistant Nerds Podcast. You can find us on YouTube, TikTok, Instagram, and Facebook. Thanks, and we'll catch you next time.